I injected my L-carnitine this morning, which I haven't been injecting L-carnitine for a while. And I did the other day, I pulled it out. And so I'm about to work out today and felt like I could get some benefit. And I did my ventral glute and hit a fucking, no, I gotta not say that word too early in the podcast. We will get demonetized. I hit a nerve in my glute and it hurt. Have you ever done that where you hit a nerve and the whole muscle like seizes up and you know you're in a nerve?
Yes.
Oh,
Yes.
it's so terrible feeling. I've done it in my delt too. It like shoots the needle out because your whole muscle contracts extremely hard.
Yep.
And now I've been
Yep.
so sore, I'm like hobbling and limping because the ventral glute, for those who don't know, it's like the gluteus medius that wraps around like the hip. It's right underneath the hip. So anything that abducts like pulls away from the body, like when you're on the abductor, the bad girls, that muscle on the side of the butt, it's in so much pain. I've just been hobbling around all day long from that. And
I
I don't
feel like
know
it's
if
only
I got any
happened to me a
benefit from the
handful of
carnitine.
times. It's only happened to me a handful of times. I feel like it's much easier in smaller muscle groups to do. I definitely have done it in my quads back in the day. If I ever would
Oh,
shoot anything, my quads, and
yeah,
that's brutal.
I've done it like one, maybe like a handful of times in my delts. It happened. It just like zing and it just locks up and like literally feels like it shoots the needle out because your whole, it's like being connected to an electrical probe. And then I've never done it in my ventral glute. I didn't even know that. I mean, that's why I like ventral glutes is because they're pretty void of
Hmm.
neurovascular bundles. But man, I hit something. Shit hurts. So I'm in so much pain. It's killing me. It's like
And you
wrapping
felt like the
around.
carnitine didn't do anything either.
Well, not at that point because I was freaking hurting all morning. Yeah, it sucks.
Uh, I
But
need to start experimenting with it a little bit.
carnitine's pretty cool. I feel like I don't know. I definitely feel like it gives you a bit of an acute boost. I think in energy, like stamina, endurance for sure. Like if I were you, I'd definitely do it before runs. I think it's highly effective as
Hmm.
far as that goes. A lot of the data that we go off of is super mechanistic, and I don't know how much of that really translates into real world. But a lot of people anecdotally really like it. I first heard of it a few years back. I think Derek had kind of talked a lot about it, but I heard about it from another guy first named Chase Irons. You know, you familiar with Chase?
I'm not.
Yeah, he's out of Chicago. He's got a small following. He has a podcast where he basically will just open up a chat section and he responds to people. But he made a ton of videos on L-carnitine. He was making it himself, and I actually ordered it from him. He would just brew it in his kitchen. He was very open with that. He had tons of videos on homebrew and how he made his own gear, and also how he made carnitine. And I just ordered it from him. So this is like 2 or 3 years ago. He's grown and he's gotten a lot bigger now, but he was doing crazy experiments. I think he was IVing it at one point and taking insane doses. Like we usually recommend 250 to 500 milligrams, and he was up in like multiple grams. So, thousands of milligrams, and talking about, like just his own experimentation. He dieted for a bodybuilding show and got super lean, and he felt like it was a huge part of that. He talked a lot about the mood effects. And I think that not a lot of people talk about that, but I do feel like it does help improve your mood. The mechanism for that is probably increased acetylcholine levels and because it can
Mm.
cross the blood brain barrier and cause increased acetylcholine, which can help with mood and focus and energy and everything. Because I remember he talked a lot about that when others didn't. And he also, at those extremely high doses, he ran into what he thought was like some insomnia because it almost gave him too much energy. And if he did it too close to
Gotcha.
bedtime, he felt like he couldn't sleep. But I think Derek and him, Alex Keuchel, a lot of those guys are kind of the first few to talk about it. And we like it a lot at like Marek. I think it's great for guys who have good levels of testosterone but are feeling like they need a little extra push. It's something that's great, and the mechanism for that is the increased androgen receptor density or an improvement in your androgen receptor health, essentially. And the androgen receptor, of course, is the receptor that testosterone binds to. So by improving those, we essentially make you more sensitive to testosterone. And I always tell guys too, like there's a ton of data at this point that the level of testosterone really doesn't dictate the growth. Like, there's a good amount of data on that. When it comes to physiologic levels, that is, of course, super physiologic levels, a different story, but they've done studies. Stu, I forget the guy's name. His first name's Stu. I know Lane Norton's close with him. He was an author on this study, but they essentially took guys, one group, high testosterone, low androgen receptor content density, And then another group, low testosterone and high androgen receptors, so more sensitive androgen receptors. The lower testosterone group, I think, performed better as far as hypertrophy and strength and things. So what that told us is it's the genetic variation in androgen receptors and what happens at the cellular like receptor and transcription level that matters more when it comes to growth than it is just the testosterone level. And then recently, I saw a study come out, and I'll have to find this one too, where they took guys who I believe were basically castrated because they had prostate cancer. And when you have prostate cancer, you want to reduce the exposure to androgens as much as possible. So they took these guys with essentially zero testosterone, and they gained like 10 pounds of muscle or something by putting them through training and proper nutrition. So it was like kind of blew the whole testosterone thing, like the whole theory that we need all this testosterone to grow muscle, completely out of the water. And I've kind of harped on that on many podcasts where I've seen literal professional athletes with a ton of muscle who have low testosterone, and it seems really counterintuitive to everything that we know. I think podcast 1, we talked about Nick Bear and his levels of testosterone and everything. And he just posted his levels yesterday. You sent them to me. What were they, 100 or something?
Yeah, dieting down for a show, and good to kind of show that that's the difference between natural and enhanced competing is when you do crash diet that hard or really try and push to that level of leanness, your hormones do suffer as a result of it. And he actually put up a video yesterday kind of going to his DEXA results as they got close. And as he really made the final push, lost some lean body mass too, which could potentially be that lower testosterone amount. So
yeah, there were some, I was looking at the comments to that, and definitely some guys like, this doesn't prove shit. It just proves that he's shut down because he was using something. That's where my mind went to. I'm like, unfortunately, this doesn't prove anything. It literally could be that he came off and now he has suppression, but it's not uncommon, like you said, that if somebody's in a massive caloric restriction under extreme physical demands, that we reduce the signaling from the brain, the hypothalamic pituitary axis, the luteinizing hormone and follicle stimulating hormone production, which his were very low. And that's going to reduce signaling to the testes. So I don't know. I think that if he is natural, it would make sense. Of course, there's always doubters, but he did say he's been getting labs every month of this, I believe, and showing them. So I would like to see that. That'd be cool.
Yeah, and I've seen some of his prior ones that we talked about were like, I think he was in the 500s, and luteinizing hormone and follicle stimulating hormone were in normal ranges. So, like we've speculated, I think there maybe was a time he probably dabbled when he was big. And maybe the last few years has kind of just transitioned and trying to do it on his own, or I could be full of shit and he's never
maybe
used
he
anything.
didn't. So. Yeah, you just don't know. I mean, I think my main point there is that if you look at him right now, he actually does, even though he's lost some muscle, he's got a lot of muscle and he's still pretty strong, and he's maintaining that with like 100 testosterone. And I think the overwhelming like thought for most people is that if you have a low testosterone, you can't hold on to muscle. You're just going to be skinny fat. You're going to, and he's proven that wrong. And Josh, I mean, I'm not just blowing hot air up your ass. Like I was with you last week, and you're a big fucking dude. Like despite what you can see on the camera right now, Josh is thick. Like, he's his calves are the size of my quads, and he's just like got huge voluminous is not the word, that's like hair, I always think it is, but a lot of volume to his body. His muscles are super full. And what's your testosterone at right now, like 600?
Probably between 500 and 600, I would imagine.
Yeah, that's insane. I mean, you're holding on, and you did things in the past, and I think we'll kind of talk about that today, is our history with these things. But you grew that muscle on that, but you've maintained that muscle. And honestly, like I told him, he was showing me pictures while we were at the gym with our other buddy Caleb, another PCC over at Marek, and we were talking about competing because Caleb competes, and Josh showed his pictures, and I was looking at his legs, and I'm like, dude, I think your legs are bigger now than when you were competing, trying to get them big. And you fricking run marathons. Like you ran 11 miles a day. Is that what you ran? Yeah. You're running
around 40 miles total this week.
Yeah, that's insane. So 40 miles of running in a week. You're on low dose testosterone, maintaining normal physiologic testosterone, and you're still able to have bigger legs now than you did when you were on gear and trying to grow your legs. I know like your legs were cut at that point, like you were lean, so you lost the glycogen and everything, but they're solid now. They're hot. Like the first thing I saw when he comes out in his shorts is big ass vastus medialis, like taking over his kneecap. I'm jealous as hell.
And my weird stumpy looking legs in a pair of jeans. All you can see is my
That's
calves,
true.
basically.
That's true. Yes. He's trying to wear
Pros and
skinny
cons
jeans,
of it.
trying to wear skinny jeans, and it's like the quad and then the little knee, and then out here is a calf. And the pants are like almost like a bell bottom because they're being ripped apart by by the
Yep.
calf.
Yep.
Yeah. But
And
it
I
looks cool
think
in
that
shorts.
it does. And I think I've really the reason behind it, and I think this goes for most guys. I actually was rewatching. Are you familiar with Ryan Fisher
Yeah. Yeah.
at
He's
all?
a
Okay.
CrossFitter. He's the guy who
Yeah. So I
cussed
was
out the
watching.
judges.
Yeah, and told him he was going to kill him.
Yeah.
So I was watching him the other day, and he was talking about like his levels, and I think Ryan's like at like 350, and that's normally where he's been the last couple of years. But same thing, like maintains a lot of size. So I just think it like probably comes through years of consistency, like that becomes the new normal for your body, is it gets accustomed to holding that amount of tissue, rather whether or not that you used exogenous hormones, obviously that can push you past a genetic barrier that maybe allowed you to hold on to more than you would have had you not used them. But I really think it probably just comes through years of consistency. Your body gets used to holding that tissue, and then it's almost harder to lose it than it is to maintain it at that point.
Yeah, for sure. I'm definitely think consistency is obviously huge. But the more I go on, I'm just like really truly believe in genetics because I've dabbled myself. And let's get into that today. Let's talk about all like where we started, when we
Yeah.
started, how we started, and all the crazy shit we've done. But I have done so much and never grown anywhere near the level because I just don't have the body to, and I've said this over and over again. And I know you say I'm big and look good and everything. I agree. I look good, but I would never, ever in a million years, no matter how much shit you put in me, unless I syntholed every single belly to just look like one of those dudes that you see on, the Instagram reels from India where their biceps are all fucked up. I would have to do that much synthol to ever look like the dudes on the Olympia stage. Where Josh, on the other hand, if you loaded this dude up with a ton of gear and extreme amounts of food and year after year, like I do think you have the physique as far as the flow and the muscle bellies and everything too. Caleb, our friend too, like I said, I think his body was much closer to mine where he looks excellent right now and he's competed and he's done well. But as far as could he go on the Olympia stage, probably not. And he knows that. We just don't have the genetics for it. Him and I both have longer limbs. We don't have the full muscle bellies like you do. I think you need shorter, stumpier muscle bellies and things like that. But genetics, like Ryan Fisher, you look at that dude and he's just got genetically like his abs like bulge, you could see like when he was a kid, he probably had that little look of being a stumpy little muscular guy. And he's super shorter than you, I
Yep.
think too.
Oh
And
gosh, by
then,
like five, I think he's like 5'5", very short.
yeah. And then there, like I've publicly said a lot of times, I've talked to Jason Khalipa, ex winner of the CrossFit Games, very, very fit athlete, and has maintained a ton of lean muscle mass. He doesn't look like a bodybuilder, but he looks like anybody, like, 99% of guys would love to look like him. Chiseled six pack, big burly chest, huge arms, delts, quads, strong, natural, definitely natural. Had me look at his labs. Let me, he said I could repeat his numbers. It was around 400, just like Ryan Fisher, lower. But he just has, genetics. He doesn't have genetics to be a bodybuilder. He has genetics to be an amazing athlete and look really good. And I think he'll maintain that as long as he continues to train, which he trains hard as hell every single day and eats right. So I don't know. Genetics, I think, play the biggest role here. Yeah, and I learned that through self experimentation, and that's what we can get into
Do you,
today.
and Yeah, and before we go down that route, do you think that back to the androgen receptor density that we were talking about earlier with L-carnitine, do you think that probably is a big variable in the genetic factor that maybe someone like me or a Jason Khalipa like just has like a just dense amount of androgen receptors that regardless of my testosterone levels from a young age, my body was just able to utilize that and maybe build a, I don't know, more muscle early on that stuck around?
Yeah, I kind of think so for sure. Yeah, I think there's definitely
Yeah.
genetic variations with that. Satellite cells, the transcription of the DNA at the DNA level. There's probably so many things that go into it. It's not just testosterone, it's not just the drugs, because like I've harped on a million times before, you can load a dude up with a ton of testosterone, a ton of hormones, and sit them on the couch, and they might have a marginal increase in lean mass, woohoo, but they're never going to look shredded and big and have, all the muscles that you want unless they put in the work as far as nutrition and exercise and all that on top of it. We do know, there was one study that showed that guys who didn't work out, that got loaded up with testosterone, did have more lean body mass at the end of the study than else. But was it lean body mass where you looked at it and went, damn, that's an impressive physique? No, I mean, it was a statistical increase. It was a small increase, but it wasn't a noticeable one, And I'm harping a lot on genetics, but I'd also like to point out Josh's hard work. I mean, he ran 40 fucking miles this week while he was he was at a conference for a few days. So away from his routine, having to go out to late night dinners, all of that, because you were texting me way after I was asleep saying you got back from a long dinner. So you're still able to fit all that in while working 2 jobs, while figuring out the podcast with us. And you're still going. And I called you last night and you were at the gym. Josh put me through a workout last week, which he said was nothing to him. And I was sore for 4 days. So the work is there too. I mean, if you don't have the genetics and you work really hard, you can still look really good. And that's where I've been able to show that. I mean, I don't think I have decent genetics, and it's not like I'm, look awful. I have okay genetics. I just don't have the bodybuilder genetics, but I've been able to capitalize on what I do have by hard work. And I've made a lot of gains in those times when I put in the most work. So it's a mixture of both genetics and work in the kitchen, work in the bedroom by sleeping, work in the gym, work on 24/7, and then the steroids are literally just a supplement. That's literally all they are. Ian Vier the other day on Bro Chat said something amazing. It was like, it's no special diet. It's no special workout. It's no special drugs. What it is I had one good day where I worked out perfectly. I slept appropriately. I had my nutrition dialed in. And then I repeated that day for thousands of days after that. And that's why I look like this. And I was like, it's exactly right. It was just the consistency, like you said, 100%. So can't harp on that enough.
Absolutely. Yeah. And I think people forget too that genetics, obviously play a big role in how you look too, but then on the performance aspect of things as well. Like there are people from, just a look test don't look like anything special, I guess, muscularity wise, but their sport, whatever it may be, or whatever activity is they excel in just because they have the muscle fiber type or, genetic predisposition to just excel in that area. So if they put in the hard work, sure, they might not look like a fitness model, but they may outperform you every single day of the week just because they have the genetics to do so. So there's a lot of variables that factor into that.
Yeah, I think we always default to what one looks like, because I think that's what 95% of 99% of the guys, including myself, always want, is to look like you're strong and lift well and everything. But yeah, I mean, I've definitely been had my ass handed to me by guys who don't even look like they lift. And especially when it comes to Olympic lifting, look at the Olympic lifters. They're so tiny a lot of times, and they look good without a shirt on. A lot of them, some of them don't though. And they're able to clean and jerk 400 pounds. I'm like, shit, I'm struggling to deadlift that. I can't imagine building the momentum to throw that up and then squat underneath it and catch it on my, my chest. That's insane. And there's little dudes who are 130 pounds that are cleaning and jerking that. And it's just mind boggling. So yeah, we're just talking more about the looks when it comes here. And it'd be interesting to look into the actual performance, because I'm always thinking about the hypertrophy, but how much is the performance increased by the drugs? And I think there might be an argument that that's where it would probably shine even more than the muscle growth alone.
Yeah, just from a ability to obviously recover at a faster rate, but then the increased force production too. That has to add to it. And if you're not training for hypertrophy, I mean, because there is, I forget who it was that I was listening to on Huberman this week, exercise physiologist talking about
Andy Galpin.
that there is. Yeah, and he got phenomenal, like super, super smart. He's got a 6-part series that's pretty incredible. You guys like to nerd out about that stuff, but talking about how, there is a point that if you do get too big, essentially like with the sarcomeres grow too much to where like it's stacked on top of each other so much to where you don't get the optimal amount of force production. So in some instances, it actually helps you to physically be a little bit smaller if you're
Mm.
training for just power and strength. So it's kind of interesting how obviously there's some correlation between being bigger and stronger, but not always.
Yeah, they've always talked about how like more muscle always translates to strength, but that's not always the case, and CrossFitters
Yeah.
proved that for sure. CrossFitters
Yeah.
like changed in my opinion, it was like CrossFitters popularized strength. In my opinion, powerlifting has always existed, and that
Mm-hmm.
was a little niche community, but then CrossFit went mainstream and it became really cool to get really strong, at least for a little bit. I know CrossFit's not as big as it once was, but it was crazy to watch those guys, because you had dudes out there who were 175 pounds and were clean and jerking 315 and then going and running like 3 miles and then swimming and shit and rowing all in a workout. So that was wild. But you would see them and just be like, whoa, they do not look like, and the females even, they're these tiny little
Yep.
females. They're throwing 200 pounds overhead. I'm like, she just did my max for reps, and I'm 100 pounds heavier than her. And then she crawled on her hands or walked on her hands for, a mile around the track and then did 1,000 pull-ups and then swam
Yep.
through a lake. It's just wild.
Yeah, which for those athletes, it's always even made more sense for me that you would add in some extra help, because it's only going to help you recover, generate just more force production when you need it. I mean, especially even from an endurance standpoint, there certainly can be a lot of benefits from it. So that's kind of the crazy thing about performance enhancing drugs. I think people think of just bodybuilding when it comes to steroids, but it's really about how you're training and how you're utilizing them. You can get so many different benefits when you do add them in.
True. Yeah. I've always wondered
Yeah.
about, I've changed my mind kind of a lot about the CrossFit athletes. I was always convinced they were on a ton of stuff. I still feel like it's probably widely used. I think every single sport there is, when there's
Hmm.
money involved, people are definitely going to do things 100%. But I do think there's probably some natural dudes out there too, that are kind of genetic outliers and who work really, really hard. I used to be convinced that 100% of people were on something and they're 100% using things. You can't convince me otherwise. And then seeing more and more professional athletes and people like that come through, which a lot of them I won't name, but I've seen their labs and they've talked to me very openly about things, and they'll literally confide in me that they hadn't, maybe are thinking about doing things for the first time, et cetera. I've kind of changed my mind. It's kind of wild. Of course, they could be lying, but I do think that there's probably people out there who will just work really, really, really hard. They have good genetics and they capitalize on that with hard work inside the gym and outside the gym 24/7. Like Ian Vier said, day after day, do the same exact thing, consistency, like you've continued to do for decades. And that's why you look that way.
Yeah, and you as well. And I think it just, I try and always explain to people that the consistency aspect of it does of course we all like the vanity part of it, that it makes us look better, but I feel like just from a personal standpoint, I excel in life just at a higher level when I'm doing those things day in and day out, having that routine. And for, the average listener or someone who just wants to get healthier, it doesn't have to be that extreme of running 40 miles a week. Just having a routine that you are following every day where you're choosing to maybe make yourself a little physically uncomfortable through exercise, I just feel like kind of puts you in a different state of mind to excel in all other facets.
100%. Yeah. Today I worked out hard and I was thinking about that. I was thinking, because I did this superset of, I just did it the other week and it burned like hell. So I wanted to do it again. It was lateral raise and then what would you call it? Front raise, like just,
Hmm.
front and pulling in front of you. And I never really did front raises in my like bodybuilding or more lifting days, and kind of hurt, but they don't hurt anymore. So I've been kind of incorporating them. And I was thinking that the superset that I was doing ended up with some total volume of like, I don't know, 30 or 40. I think I was doing 20 of each and just grinding it out with all kinds of pain. And I was thinking that from a scientific level of thinking, if you're going to hash this out as far as like, is this optimal for hypertrophy or strength or whatever? Probably not at all. but there gets to a point, like after my lateral raises, my delts are pretty dead. And then I have to start doing front raises. And I think I was doing 20 of the lateral and then 20 of the front with a lightweight, like 20 pounds. And as soon as I start to do those front raises, like the quit in me just starts screaming, like, stop, this burns, stop. And I was thinking that this is not even a workout for my delts at this point. It's a workout for mental toughness. And if people are going to the gym and only thinking and analyzing, like, what, like, fractional plate can I put on to have X amount of, progressive overload this week? Like, you're missing the point of the gym. Sometimes you just got to go in there and get really uncomfortable and grind it out. I mean, there's bodybuilders, that'll do insane drop sets. And when you look at the science, you're like, oh, that's not superior. They could have got much more if they would have just, done one rep more than they did the previous week, but they're growing. And, I think the biggest thing is they're growing mentally. Like, those, like Ian, like I has said, and Fuad and all those guys, they're very successful in their personal lives because they learn to push through that. And CrossFitters even more so. I think, if you want to feel pain, just do a CrossFit workout, because you start feeling like you want to quit maybe 1 to 2 minutes in, and then you look up and there's still 15 minutes on the clock where you got to continue doing the same stuff, and you have to learn how to, like, dig deep. And there was times in my life, like I was just talking to guy yesterday about studying through school, like all through graduate school and everything, where I would stay up all night long and just grind. And it was similar. It's different pain, but you're like, man, I really want to quit right now. I really just want to watch TV and kick my feet up. But you have that mental toughness instilled in you from the workouts, I think, honestly, where you're like, I didn't quit today at the gym and I won't quit now. Keep studying. I'll go to work. I'll keep working. Like, I work 7 days a week right now. There's a lot of days I don't want to, but it just instilled in me now, So I think there's deeper things. And yeah, at this point, I talk a lot about what you look like and the muscle growth and everything. But I think that's the most important to most guys at this point in my life and your life too. I know we don't care about that. I mean, every guy would die to have your physique, probably mine too, but we do it now for longevity and health. And like you said, feeling better, having a routine, all the strength that builds mentally, spiritually, if you want to say, all that. So there's a lot of things outside of just strength, or rather not even strength. A lot of guys don't care about strength. There's a lot more outside of hypertrophy growth.
Yeah, absolutely. Absolutely. And just the, I don't know, the positive reinforcement of the little wins that it gives you every day of like, hey, I was strong enough to push through that. And that just, again, kind of carries on into everything else that you're doing. Like you were saying, when obviously another tough obstacle is going to come up in life, that's how it goes. And just, it kind of gives you this little like umph of confidence in yourself. Like, hey, you know what? I've been following this routine. I care about my health. If I'm strong enough to do that day in and day out, there's no reason that I can't tackle anything else. And if, I always tell my wife that, from us doing this podcast, even, that's kind of the biggest thing that I want to instill into people is, your health and fitness really is just about that it's building a foundation for the rest of your life that's going to allow you to excel in all other areas. Obviously again, looking great benefit of it is awesome. But when you start viewing it through that lens, I think it changes it a little bit too, and makes it a little bit easier to fall in line with the routine, because that it's about a lot more than just how you look in the mirror.
Yeah, it teaches you so much, because even the how you look, it takes so long. If even if all you're doing is caring about what you look like, which is fine, but you learn a lot through that. Because how many people go to the gym and even if they give it a month, their body's probably not going to change at all, really. I know mine really doesn't in a month. Not, I mean, now it might, because I have a lot of muscle memory and I do make changes a little bit quicker. But in the beginning, it took a while. I mean, it was a while before I started looking like I actually worked out. It might have been a year or two for me. I had a friend who was one of those genetic outliers who, like, within the first week of working out, I was like, holy shit. And I knew he wasn't doing anything because we were too young. And he was learning everything from me. I was telling him what we should do, because I was the one like reading bodybuilding.com forums and stuff. And he was literally like within his first year of lifting, benching 315, like just bulging out of like the wife beaters. He was insane. And in high school, I remember even when we would have those fitness tests and we would train for them with the pull-ups and sit-ups and everything, when we
Yes,
would train
yes.
for that for like a month of pull-ups, it would like every year he would develop this baseball of a bicep from the pull-ups and he would flex and everybody be like, oh, because they had so much like genetic potential. It was crazy. But get back to my point, you have to put in so much work for so long with such delayed gratification that you learn
Yep.
that. I mean, that's like my life. When you're somebody who pursues like medicine, you better get really used to delayed gratification, because you're talking about 4 years of undergrad if you can get out in 4 years, and then 4 years of your medical school, and then anywhere from 3 upwards to 7 years of residency. And then a lot of people will do a 3-year fellowship after that. So it's just 10 years of post school. And then you got 8 years. So you're looking at like 18 years before you even start working as a doctor on your own. That's after high
Yep.
school too. So these are people who have like won't even get their first normal paying job for 18 years. Some people, like neurosurgeons, things, do a fellowship after their long residency. So you have to be really used to delayed gratification. It took me I think it took 5 years of undergrad, 4 years of school, and then 3 years of residency. So like 12 years. And I think that like fitness taught me to be okay with that. And then I'm still
Yeah.
okay with it. I mean, where some people fuck up, like with finances, is like that delayed gratification. You finally get your job and then you go buy a Mercedes and your doctor house and everything. And I've been like, hey, I've delayed gratification for this long. Let me do it for like another decade. And let me just save every little bit that I can. And because I've learned it from fitness and stuff, I know it, I'm like, let's suffer for a little bit longer. Let's see how long we can go.
Yep. And I think I've heard Huberman talk about this too, that like even with just like small things that you delayed gratification on, like I'm going to wait a little bit to eat, or I'm not going to snack on that. I'm going to save that treat for later this weekend. It again kind of builds those little wins within you, just like you saying, well, even though I have money in the bank, I'm not going to spend it all. I'm going to choose to be frugal. Like it just, I don't know, kind of gives you this like internal little boost and power of like, man, I can do this with anything. And I think just gives you a lot more control, maybe over just impulses everywhere else in life. And like you were saying, fitness is a great, analogy to use for kind of just building that foundation and that wall up year over year. And that goes for obviously so many different things, your finances, your career. I know you and I talk about a lot that like we kind of live our lives like a monk sometimes and are up at 6 a.m. on Saturdays and Sundays. But for right now, I'm fine doing that because I know that there will be a day that it doesn't have to be that way, but I'll have done the work to allow myself to do that. And I think that's for fitness, like we were saying, eventually you get to a point where things are easier to maintain. It's just like a business, it takes you probably years to get to that point to where you can step away a little bit and it doesn't take so much hard work and dedication to maintain what you've built. But that's a byproduct of everything that went into it for years and years beforehand.
Yeah,
And
that's
sometimes
me.
people only see that end result. Yeah. And they think like, oh man, I just want to, get to that basically. And it's like, well, you would never have that ability to do that if you were not somebody who didn't have the, I guess, strength and patience and consistency to actually get there in the first place.
100%. Yeah, that's me, right? That's my physique exactly right now. Anything that I have, I work out 2 times a week right now, Saturday and Sunday. And throughout the week, I may try to do some push-ups and squats and walk around the building a few times. In the summer, our walks will increase because we'll be able to. Other than that, it's literally what maintains my physique. And I don't think there's a person who would say that they look at me and don't know that I lift. They would
Hmm.
say like you've got a physique of, it's above average for sure. Hermosi talks about that. He says Stan Efferdine told him that his physique is now it's like a passive income essentially, where he
Yeah.
put all the front work in and now he has to do
Hmm.
very little to maintain, just like you said, like business. And I 100%, when I heard that, I was like, oh, hell yeah, that's what I got. I got a passive income on my physique,
Yep.
100%,
Yep.
because I put years and years and years in. And now I no longer have the time, or that's a lie. I hate when people say that. I have the time. I no longer have the desire to do that. I put my
Yep.
effort into other
Your
things like
focus is
business.
different.
Yep.
Hmm.
But I maintain that. I maintain it for health and all of that. I want to stay strong. been able to maintain most of my strength and most of my ability, and I can still function, and I have the metabolic benefits and things. But it's like, passive income now, which is nice. And then,
Yeah,
yeah, to your point
absolutely.
of depriving yourself of things, I think it helps so much. I do it every day. There's like, I'll try to purposefully, like the easiest way I think to do it is with your phone. When you want to reach for your phone to check Instagram or something, just
Mm-hmm.
be like, nope, like don't do it. And then yeah, those little, it's just like, I can't remember. I'm sure Huberman always just harps on dopamine. So I'm sure it has something to do with the dopaminergic pathway. Either way, anyway, I think it's beneficial. And that's a huge thing. Like if you can do that, like try to do it 5 times a day or 10 times a day, make it like things that you want to do. I'd say like for younger guys, big things would be like, if you want to like look at porn, just be like, nope, like just don't do it,
Yep.
just deprive yourself, because there's going to be a strong urge for that. And if you say like no to
Yep.
that, that's big. Phone, like TikTok, Instagram, younger guys, don't do that. Like your life will be so much better. I'm not saying that porn or Instagram or TikTok are necessarily bad for yourself, but if you deprive yourself from them, you learn how to deprive yourself from things that give you immense dopamine explosions, essentially. And I think what you do then is store your dopamine up, and dopamine is very motivating. And so you continue to be motivated to go grind for other things and put your effort and energy into other things that are more important, like studying or work or what have you. So as a young guy, try to
Yep.
deprive yourself of some of those like pleasures, those instant gratification pleasures, and it'll go far.
Yeah. No, and I think you and I have talked about that a lot with the social media. Just that we think that's probably a big issue for most people that they don't even realize is I think probably every day too, you just have this certain amount of bandwidth that, even just mental acuity that we've got. And as you started that, each dopamine hit is just pulling a little bit from that. And I know even, just anecdotally on days for me when I'm just kind of one of those constantly scrolling or always pulling up my phone. By the end of the day, I'm so much more drained or don't have the drive to really do the things that I probably need to close out the day. Whereas days where I'm kind of locked in, have, just very lasered in focus on one task after the other without any of those other things causing my brain to scatter and squirrel brain, you just feel like you've got a lot more left in the tank. And in my opinion, too, helps you enjoy a lot of what you're doing in the now as well. I think sometimes like your phone and things are an escape from what's actually going on. And sure, work sucks, sometimes, and your day-to-day tasks aren't the most fun. But if you can just get focused in on those without having something pull you away from them, I think you can actually learn to enjoy them a little bit more too.
100%. Yeah, I think I remember there was a time a year or two ago when Victoria left for the weekend to go see family, and I didn't go along, and I wasn't working with Marek yet, so I wasn't working like my 7-day week crazy weekends. I had the weekend off. And I remember just like kind of sitting around super bored after the gym. I really didn't have much to do because I don't really do much unless she's around. Now I do a lot of work and stuff, but she's gone. I remember just like looking at my phone for like hours, because what hell else was I going to do, and just scrolling and being bombarded by Instagram. And I felt wrecked at the end of the day. I remember literally
Yeah.
feeling like my eyes kind of hurt, which is a physical thing, but even like internally, I just felt drained and kind of blah and zombie.
Hmm.
And I almost felt depressed. And I wasn't depressed for any reason. I just felt depressed because it was like, I literally feel like my pool had been drained, like you said, because I do feel
Yeah.
like you've almost got like this, and I don't know how much truth there is to this, but it feels like you've got like a pool of dopamine that probably replenishes like every day or through other activities or what have you. But you definitely, it's like finite, like, or it can be used up. It will replenish eventually,
Yep.
but it feels like it can be used up. And you get that way when you do certain things. You have like, yeah, and that's probably the issue with when it comes to like using things like cocaine or ecstasy is, you use up all that so much like the night before. People will feel depressed for a few days later because it's trying to recuperate. That's well known. That's been well known forever. So I don't know why we don't
Hmm.
realize that you can get hung over like that if you bombard yourself with dopamine all day long the same way. It's almost like a teeny little microdose of ecstasy, boom, 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 tick tock, tick tock, tick tock, and then you're just
Yep.
depleting yourself.
Yep.
So, I mean, you would be much better off doing some things that make you uncomfortable, holding back, like you said, living almost like a monk, because it makes things more enjoyable. You have more drive. You're able to tap into that dopamine when needed, rather than just chronically, letting it leak all day long.
Yeah. And I think the times that you then, and when we say live like a monk, it's Adam and I don't just sit in a box all day and eat chicken and rice. Like we have social lives, we have things that we go and do for fun, obviously outside of fitness and work and things of that nature. But it makes those experiences so much more enjoyable, in my opinion, because you've earned them when you get to them. My big outlet is hiking. And, here in April with one of my good buddies, Grant, we try and do 1 to 2 hiking trips, kind of more extreme, crazy hikes a couple of times a year. And whenever I get to those, I'm like, man, it's like such a release for me because, again, I've been working hard. I've earned that time to go and just kind of do something I enjoy. Whereas the opposite, when you're just kind of constantly taking in dopamine and not really having a central focus on bettering yourself every day, you don't really even get the same amount of satisfaction you probably would from doing the things that you normally would enjoy.
Absolutely. I think we exhausted this topic and we never got to we never got to our intended thing, like what drugs we've used, why we use them, and why we recommend that you do not. So let's do that in the next episode. What do you say? Should we just do
You
another
want
one?
to?
Yeah, let's do
Yeah.
another one
You're
the next time. We can cut this one. People are going to get bored of us. Do want to tell people that we are now going to be sponsored by Marek Health, and definitely want to remind you guys to go check out Marek Health if you haven't yet. That is where Josh and I met. Josh is a patient care coordinator there. I'm one of the providers there. If you don't know what Marek Health is, it's a telehealth platform. It's I don't even like to call it telehealth. I think it's overall optimization. I don't even like to think of it as medicine. It's literally everything that could possibly make you better. Conversations like this can occur with your PCC because you get to meet with a dude like Josh and myself, And then what we do is we do extremely in-depth lab work. That's kind of how we start, just to get a look under your hood to see how you're functioning from a cellular physiologic level. We can check out things like hormones and inflammation and vitamin levels, nutritional statuses. And then we just basically give health coaching based on that. And then we team up with various providers, doctors, nurse practitioners, physician assistants, et cetera, in your state, who could facilitate any treatment that you may need, be that hormone replacement therapy, or maybe you need to monitor your blood pressure, or maybe you are pre-diabetic and you need some glucose control. And I like to harp on the fact that we are not a TRT clinic, and don't go to a place like Marek Health if you just want testosterone, because testosterone is something that we may do, but we do not only do TRT. We want to talk to you about how to make your life better. When you sign up with Marek, you're going to get bombarded with a massive packet of recommendations, things like viewing some sunlight and getting excessive amounts of cardio, what you may think is excessive, but is, literature backed amounts of cardio and resistance training. We want you to track your macros and figure out your nutrients, and we suggest certain foods that you probably aren't getting. We can set you up with dietitians and health coaches. We're going to do everything else outside of just the med. So if you just want to go to some place to get TRT, which is cool, that's fine. Go to a TRT mill. But if you want overall health optimization and you want to better yourself as a human being, inside, outside, you want to look better, feel better, excel at your job, you go to a place like Marek Health, because we're going to take a really big, deep dive into that. And that's why I've been so passionate about it since the day that Derek over at More Plates, More Dates reached out to me and asked me to join, because I knew that he was on this new path of, he fucked around with hormones at one point in his life, and all he cared about was steroids. And he changed. He's a highly successful businessman. He cares about his health and his longevity. He cares about being there for his loved ones and continuing his progress in life. And he wanted to develop a platform where men like him, who wanted to excel and become better than themselves, than their current being, and become a new ascended version of themselves, could go to and get the help from cutting edge research that, unfortunately, medicine right now won't do. Unless you have an issue, medicine's not going to fix it. It's just going to react to things. And so we wanted to build a platform where we could prevent things, and not only prevent things, but make you, a superhuman. So that's my little spiel on American. I mean, you've been there a few months now. What have you experienced?
Yeah, I mean, and to Dr. Hotchkiss's point, I think the services we provide at Merrick are just so vital far beyond just a hormone replacement scenario. And I know Derek has talked about it even on other podcasts, that it is, really, I'd say about 50-50 with the patients that we see come through that are even on hormone replacement. There are a lot of people that come in that have great natural levels, and we start looking at really everything else under the sun as far as what we can do to help optimize, any issues that they may be having, or just from a preventative standpoint. I think the old school approach of medicine was to not really worry about things until you hit a point to where, like, oh, okay, now there's actual red flags. And it's like, well, if we were to start addressing those early in your 20s and prevent there from ever even being any red flags, why wouldn't we do that? And I think that's kind of the service that we provide, and also teaching the average everyday person, like myself, who is not medically trained like Dr. Hotchkiss, to learn, when they're going through their extensive blood work with their PCC, and then a provider, about, understanding, hey, this is why this level is suboptimal for me, and why it's important, or, why it's such a negative thing for my heart health to have high ApoB levels. I mean, things that most people, 5 years ago had no idea about, but now you can almost become your own little expert when it comes to your health and longevity. And it's, really, really awesome. And for me as a patient care coordinator, it's been such a fun process getting to see how many lives we get to change through, not only addressing any medical issues that we might need through pharmacology or hormone replacement, but teaching those healthy lifestyle factors that Dr. Hotchkiss is talking about. And most of our treatment plans come with all of the different exercise programming that we recommend, as well as guided meditation resources. I mean, really anything you can think of, how to optimize your sleep, everything that goes into keeping you the healthiest that you can be long term. And, the I guess, one-on-one relationship that you build with someone like myself as a patient care coordinator is really awesome to see, because we're kind of your first line defense for any questions that you have, maybe any, beyond just your medications and having questions on those, but things that we can help you to implement in your day-to-day life. And I think for us, that's probably what makes it the most rewarding, is those long-term relationships and getting to see people change their lives through addressing anything they need to, health and wellness.
Absolutely. Hey, to your point, you said, you didn't learn the things that, a doctor would have in medical school or such. Doctors didn't learn that thing either, to be frank. We have courses like anatomy, physiology, pathology, where things are bad. There's literally no course that says optimization 101, where we take a healthy individual and get them to better than healthy. We're always trying to, in medicine, we allow things to go on, like you said, until you reach pathology. And then we try to get you to a state where the pathology is basically managed and isn't causing more issue. And that's really about all, like we kind of patch up the leaks, and medicine's great at that. And I don't want to take away from medicine and where we're at. Medicine has done amazing things, but now there's a whole new emerging field of people who say, I just don't want to be status quo. Or in fact, I never want to get to the place where I have pathology. I want to be beyond. I want to be better than I am now. How can you? And you can't go to your doctor. Insurance isn't going to pay for you to go to your doctor and say, hey, I'm perfectly fine. I'm great. I feel amazing. I want to feel better than amazing, and I want to excel. Insurance is never going to cover that, ever. The doctor would not know what to do with you. They would be like, I have patients tell me all the time, I went into my doctor. I didn't feel good. I told them, I'm doing all this stuff right, but something's still missing. And they say, sleep more, which is a great recommendation, but it's like, it's pointless if somebody's got like a hormonal deficiency that you haven't looked at, and they won't look at it until they think, in their mind, testosterone shouldn't be low until somebody's like 50. We won't look at it until then. But hey, maybe there's something else going on. Maybe this dude has environmental exposures or something that's causing him to have lower hormones, like low thyroid or something. Maybe there's an inflammatory condition like an autoimmune. And when you start mentioning these kind of things to your normal doctor, they look at you like you're a quack. And that's fine. I look at a lot of people like they're a quack too, and I understand where those people are coming from. But just to your point, I mean, Marek likes to scour the edges of the earth, and literally we have people all around the earth, which is really cool. You'll be talking to people from Australia and Thailand and the UK, all of these people, because there's a really small group of us people who want to do this stuff. Like there's really cool, unique niche in life where we want to make people better versions of themselves. And we've kind of all come together and we have this like collective mind. And, it's not really, that's why I say, I don't even look at it as medicine or healthcare. It's different. I mean, we will link you up hopefully with a doctor who has that similar mindset, so that if you do need any medications, they can be, abide by the rules and legal laws of prescribing those. But, talking to somebody like yourself who is running 40 miles a week and maintains a physique, like that's priceless. It's cool. So this was much longer than any ad that Marek would have wanted us to run for them, but I just wanted to harp on it a little bit. We'll come up with a better little like read that we'll throw in, and like, this is sponsored by Marek. We'll come up with one of those eventually. But if you haven't checked out Marek already, do, and we can meet with you guys in person, or kind of in person on Zoom over there. It'll be a lot of fun. So looking forward to meeting you guys.
Yeah. And one other point I'd like to throw in on, everything Dr. Hotchkiss said, I agree with. The cool thing that you're also getting at Marek is we're all continuing to learn as well. This is still a space that's, still developing as far as the anti-aging longevity spot in medicine. And, the great part is all of our PCCs to our providers and even our patients, we provide, clinical resources and podcasts and webinars that happen, ever so often. So, we're all trying to continue to learn as the space grows. So, a lot of times I think in medicine, and again, this is not to, down the US system how it is. Some people just have to get stuck in their lane, and that's how they treat because they don't have the time to learn. Whereas we have the benefit to continue our education, and maybe one way that we view treating a certain ailment might shift over the years. And that's what's kind of cool, is that I think we're kind of at that cutting edge of the space, and that who you're working with is always trying to better their knowledge and keep you up to date as well.
Exactly. So 30 minutes later, long story short, we are now sponsored by Marek Health. So you're going to be hearing a lot more about them, and we look forward to seeing you over there. We'll see you in the next episode of the Atlas Hour.